Okay, so welcome to Create Connect. We're covering two different but connected subjects this morning. We have a new tool for customer check-ins that have been developed by our colleagues at Service New South Wales, and we have new advice relating to the increase in audience capacities for theatres, cinemas and concert halls, which was announced by the New South Wales Government last week. Before we start, I'd like to acknowledge that all of us here are located somewhere on Aboriginal land across this vast place now called New South Wales. I live and work on Bidjigal and Gadigal lands and pay respects to elders past, present and emerging. My name is Beck Dean and I'm an Acting Senior Manager in Policy and Partnerships at Create New South Wales. There are two of my wonderful Create New South Wales colleagues on this platform, Merrily Ray and Ivana Jovanovic, who will help moderate questions as we go. And so that we can focus on our speakers, we ask that you mute your microphones and turn off your cameras. There's a chat box also in the right-hand side of this window, and you can click on that and open it up and ask questions as we go, or just say hello. It's really great to have so many of you online today. So we'll also have questions and answers after these presentations. So we expect that the sort of talking part from us is going to run for about half an hour, and after each of these presos you'll have an opportunity to ask questions. I'm expecting a lot of questions in relation to theatre capacity information. I want to clarify before any of that happens that I'm not from New South Wales Health, so that if there are specific questions that I need to go back to New South Wales Health to get answers to, I'll take these on notice and we'll update these in our frequently asked questions part of our website. So now I would love to hand over to Belgian Tran and Clara Lawrence, who are our colleagues from Service New South Wales, and they're going to be talking us through a Service New South Wales app, which is a COVID safe check-in, and we're going to be talking through benefits for businesses and organisations in using this app, as well as benefits for customers. So Merrily, if I can ask you to hand over to Belgian so that she can present that presentation.
Good morning, everyone. Can you see my?
Yes, I can see the screen. Thank you.
My apologies.
That's okay.
Okay.
Great. Thank you.
So the New South Wales Government has launched a COVID safe QR code, as you're all aware, as part of the public health order and the current COVID climate. Businesses are either mandated or strongly encouraged to have a COVID safe plan and register as COVID safe. And as part of that process, about a month ago, New South Wales Government has introduced a New South Wales QR code. It's a unique QR code per business that allows the business to meet their record keeping requirements, which means that it's free, it's digital, it's contactless, and it goes to the heart of what COVID safety is all about. So this is on this slide. You'll see an example of the QR code poster that has been sent out to all COVID safe registered businesses, and now it's available online for any businesses that wish to register as COVID safe. So the key messaging is that customers are encouraged to check in before entering the premise, and they do that by using the Service New South Wales app. So the app is a general app that customers may use to transact with New South Wales Government, not just for the QR code. So things like customers may already have the app to check their demerit points, for example, pay fines, have their digital driver's license. But with the COVID safe check-in, it also allows them to scan the QR code and check in digitally and contactless, as I mentioned earlier. And there's two ways that they can do that. Any customers that have already a My Service New South Wales account, once they scan the QR code using the information that's on their profile, they'll check in to the venue. We present the collection notice, so the terms and conditions, and so they're aware of what information is being collected and who it's being shared with and how long it's going to be stored. So it's a two-step process. Any customers that do not wish to use their account or don't have an account, to ensure that it's a seamless and quick process, they can, using the app, scan the QR code, enter in their name and mobile number, and check in. The mobile number is validated, and the reason for that is one of the comments that we had from New South Wales Health is that they're finding it really difficult to contact people because either they haven't left their number or the number doesn't appear to be correct, or if it's handwritten, it's not legible. So we ensure that the information that we capture is validated, and it's an added assurance for our New South Wales Health colleagues that they'll be able to contact the person if they need to. The way that this program is designed, so this goes through what it looks like on the app. So it's just on the tools on the home page on the app. The way that it's designed is the privacy and the security of the data is paramount, and it's at the heart of the way that it's been, architected, and that's why we also use an app. It means not only that customers can check in quickly because they can either store their data on their phone as a guest or against their profile. So the next time they check in is quite quick. It also means that the information is verified, so such as the mobile number, and if they have an account, their email address. And also the information is captured and stored for 28 days in line with the public health order, and it's only accessed by New South Wales Health for contact tracing purposes. And the regulators can see aggregated data only to be able to carry out their regulatory work. If you haven't seen some of the key messaging, Cara, did you want to speak to some of the key messaging for our customers and businesses?
Sorry, yes, I will. Sorry, Belgan. Just unmuting. Hi, everyone. Thanks for joining us. So just in terms of the purpose for why we think this is an effective tool. So we've had experiences with, say, venues like Maryvale who've been testing it, and they're 40+ venues, and they did find that people were putting in false details. So this is an extra assurance that the veracity of the data is there, and obviously for the purposes of really sound contact tracing, absolutely secure, and an easy customer experience where they do have the actual code. So it's about protecting people protecting themselves, the customers protecting themselves, as well as the community. But yeah, it's really that assurance to business that they have the confidence that the data that's being collected is correct, and that they have all the support so we've got collateral, we've got signage, etc. So that's a really simple step. Once people have actually registered as COVID safe on newsouthwales.gov.au, they can then download all the various collateral. They get the QR code generated, and it's just a matter of them printing it out and installing it in their businesses. So yeah. So we've got some materials that can be shared on social as well. Just lost your screen, Belden.
Oh, sorry.
Sorry.
I'm sorry, I haven't used this GoToMeeting before.
No, that's all right, nor have I. Apparently I've got a lot of feedback as well. So I
have no
might
idea
just
how to share it again.
summarise. That's okay. So we've got, everyone's seen the We're COVID Safe posters, that round sticker. We've got other supporting collateral for how customers can be safe in your business and staff to be COVID safe in your businesses. We've got translated materials, in 5 different languages. And then, of course, we've got the QR code, and it's New South Wales Government branded, so I think it gives people that confidence that it is, endorsed by New South Wales Government and therefore Department of Health.
Thanks for all of that. I guess there's one question from the sector. Belgian, could I ask you to turn off your mic, please? I think it's yours that's giving the feedback. Sorry. Thank you. A lot of our sector has been open for quite a while, and a lot of them have already engaged with third-party providers, I guess, for QR codes. Is it okay if they stick with these codes that they've already got?
Yeah, so it's not mandated through New South Wales Government to use this currently. It's strongly encouraged. As I mentioned, the privacy and security of the individual is at the centre of our design, and some of the feedback that we're getting through our, privacy channels is that the QR codes that are currently available that are captured by private enterprise, not all, potentially some, that customers are now seeing they're being contacted by various for marketing and so forth, and there's no guarantee around. That's the contact tracing is the only use of the data. So this also, from a business perspective, ensures that, as I mentioned, the information that's captured is validated. It's very timely, accessible by New South Wales Health because they have direct access to this data. Is under the public health order, for example, the businesses are responsible for accurately capturing the information and sharing that information within a certain time period with health at the time that it's requested. So this takes that responsibility away from the business and onto New South Wales Government, where we ensure that the data captured is correct and we share the data, or well, health self-serves the data directly as they need from the information that's captured, and the responsibility that remains with the businesses to ensure that the customers are checking in. So when the customer checks in, there is a confirmation screen they see and they get on their phone, which they can present to the business, and at any time, if there needs to be a check, the customer can represent that screen if required. So from an overhead and responsibility perspective, that does ease some of that for the business, but also just we do have, in regards to technology, we have 2 million customers currently that have downloaded the app, and we have 5 million customers that have the accounts, and the communications from the COVID safe media campaign is all around customers to get the app, be prepared, and that they may be asked to use the app to check in at an establishment or a venue that they visit. There may be further developments in the space around who may be required to use it from a government perspective. However, at the moment we're just strongly encouraging people to update for the reasons that I've spoken to earlier. I'll go on mute just. Sorry, Beck, you're on mute. We can't hear you.
Sorry. There's a couple of questions that we can probably answer straight off the bat, but I don't think other state health tracing is involved in this. It's only New South Wales Health that have access to this data for 28 days.
That's correct. So it's in support of the Public Health Order and our Ministry of Health here in New South Wales.
And there is a question about whether the venue gets access to all the customer data, and is it downloadable?
No. So the information. Sorry.
No, that's okay. I did answer this one in chat. So it's obviously personal customer data. So it's held by us and only shared with New South Wales Health for the purposes if contact tracing needs to be done. And if it doesn't need to be done, then that data is destroyed after 28 days. So that's really about giving the customers the assurance that their data will only be used for contact tracing purposes. It's an interesting question as well around, de-identified data. So we've been dealing with the stadiums and working on getting up a pilot of this as well, which is a really complex exercise if you think of the volume of people going into sporting stadiums. They were asking if they could have access to data that's not identifying the customer, like de-aggregated data. And I think, for the purposes of a business, it would be really useful for the business to know, like, how many people are checking in, at what times, etc., in terms of influencing customer behaviour. So that's something we've kind of taken away, Belgium, to go, what is it that we can share with businesses that is not actually going to, identify the customer's specific personal data. And one of the other questions I saw online, which is a great question, is about, and this is the same as stadiums, they're managing the contact tracing currently through their ticketing system. So people need to, if I'm someone buying a ticket and I've got 4 other friends who are going, I'm the contact for that. So for the purposes of contact tracing, I am the contact. And what we've said to Stadium, what we would say to you as well, is this gives that added assurance that, who attends is who they say they are on an individual basis, if that makes sense.
Yeah, so your ticketing is still a valid way of collecting, but you can also use this as customer, it's a form of also customer assurance as well, because as we know from a lot of the data that's being collected from audiences, is there's still quite tentative feelings about getting that. And there is one more question about someone can't find the check-in on the App Store.
So it's the Service New South Wales app. It's a Service New South Wales check-in is an option on the Service New South Wales app. I'm happy to share the link. Beck, you're on mute.
Belgian, if you could go on mute now, please.
Sorry.
So there isn't it isn't a requirement that you use this QR code check-in. It is a thing that has been developed by Service New South Wales, and you may use it if you want to. So just to be clear, we had this webinar booked in with Service New South Wales to talk about their new app and the use of it by arts organisations. And we have tacked on, because it happened last week, discussion about increased capacity for theatre venues. So the two are related, but they're not part of the new requirements for theatres. So that is something I'm going to be discussing now. Okay. There is no expectation that you have to do this. It is something that Service New South Wales have developed for you. You can use it, but it is not mandatory.
I might just jump in and add to that, Beck. So in terms of the number of people who actually have the Service New South Wales app, so we've got almost 2 million people. That's a quarter of the New South Wales population. So people already use the app to download the digital driver licence, for example. We've got about, I think it's over 1.7 million people who have the driver licence on the app already. They use it to do the registration, etc. So the call to action is not standalone, do this purely for contact tracing. A lot of people already have it. We would obviously hope that more people would see a use in downloading it for this. But yeah, just to be clear, it is the Service New South Wales app and it's used for multiple purposes as well as this, yeah. Beck, you're on mute.
Thank you so much for joining us today to discuss this new app, and hopefully it'll be working out for making contact tracing faster. So thank you, Belgium, and thank you, Cara, for that part of the webinar. We'll now move on to the second part of our webinar. If anyone does have any more questions about this app, I will take them on and we can field them to Service New South Wales for clarification. Thanks very much.
Thanks for the opportunity.
Thank you.
Bye-bye.
Okay, so now I'm going to move on to talk through the increased capacity for theatre venues and what that means for theatre. So Merrily, if I could get access to showing my screen, that would be great. Thank you. Okay, so just prior to us getting online, New South Wales Health have now updated the COVID-19 safety plan for cinemas, theatres and concert halls. So you will be able to go onto this part of the New South Wales Government website and you'll be able to access this information. For the benefit of today, I'm going to talk you through it and we can engage with you on the various details of this plan. If you do have kind of detailed questions that are health-related questions that I can't answer in this webinar, please do put a question into the chat box. I will take it on notice and I'll get clarification from New South Wales Health as soon as I can. So as with the information that was provided in July in terms of your ability to reopen venues, we're looking at these things: well-being of staff and customers, physical distancing, hygiene and cleaning, and record keeping. Of course, the issue that we're most concerned around, because this is the thing that has changed, is physical distancing, and that's what is the main change in this safety plan. But I'm just going to go through this with you, and you can ask questions as we go. So in terms of well-being of staff and customers, you're looking to exclude staff and customers who are unwell from the premises. And so you need to develop a plan around that. You're to provide staff with information and training on COVID-19, including when to get testing, physical distancing, wearing masks and cleaning. You need to make your staff aware of leave entitlements in case they're sick. You need to display conditions of entry on your website and social media and venue entry. And you need to consider whether appropriate cancellation or flexible booking is available for the shows that you're selling tickets for, to discourage people who are feeling sick from attending a show. You need to ensure that your plans are in place. You need to engage with your food and drink services within the business and refer to the guidelines for cafes and for restaurants. And you also need to have safety plans in place for other kinds of bookings of your venue, including weddings and corporate events. So in physical distancing, this is where the main change is, and this is the key bit of information that you may have questions to. Your capacity must not exceed 1 person per 4 square metres of publicly accessible space, excluding staff, or 50% capacity of the venue, up to a maximum of 1,000 persons, whichever is the greater. And children count towards the capacity limit. So you'll be glad to know that children count. So this is the key bit of information. So we're looking at 50% capacity, that's the seated capacity of your venue, up to a maximum of 1,000 persons. Or the 4 square metres of publicly accessible space. So any worker in the space is not to be included in this capacity limit, as was the case for the last set of plans. Seated groups or individuals should be separated by 1 to 2 empty seats on both sides to support physical distancing. Now, I already have clarification around a lot of the questions that have come up in relation to this. You may seat in all rows of your theatre space, but booked groups or a booked person must have 1 to 2 seats either side of them to support physical distancing. So you must have strategies in place to ensure physical distancing between non-household groups. So there are a range of ways that you can do this, and different organisations have different approaches to this, and one of them is checkerboard seating. Another one is checkerboarding in groups. So there's a number of ways that we can do this, and I think what I'll be doing after this webinar is to basically engage with a couple of organisations and actually show you their plans so that you have a better understanding of how potentially to approach this. If you have multiple spaces, consider staggering the start and end time of different shows where possible to minimise crowding in your venue. You must reduce crowding where possible to promote physical distancing with markers on the floor in areas where people are asked to queue, such as for ticketing or to order food or drinks. You must promote online ticket purchasing and electronic ticketing where this is available, and use separate doors and rope barriers to mark entry and exit wherever practicable. So that's to basically stop people from coming face to face in relationship to each other in the venue wherever you can. You must consider strategies to manage crowding during an intermission, such as a longer intermission, or encouraging people to take food or drinks back to their seated area, or adding different food outlets around the venue to reduce crowding around a particular zone. Where reasonably practicable, ensure that your staff maintain 1.5 metres physical distancing at all times, including at meal breaks, in offices and in meeting rooms. If you're not able to physically distance or work in a role with significant public interaction, it's strongly recommended that your staff wear a mask. In relation to meetings with your staff, use telephone and video for essential staff meetings where possible. And stagger start times and breaks for staff to minimise risks of close contact. Consider physical barriers such as plexiglass around counters with high volume interaction with customers. View regular deliveries and request contactless delivery and invoicing where practical. And have strategies in place to manage gatherings that may occur immediately outside your premises. If you're a larger venue, you may want to coordinate with public transport where possible around strategies to minimise risks associated with transportation to and from your venue for larger shows if crowding might occur. And encourage private transport options to minimise crowding on public transport where practical. And consider parking options close to the venue, and make sure that your patrons know about these possibilities. So in hygiene and cleaning, I believe that most of this information is identical to the last guidelines that were produced. To adopt good hand hygiene practices, to ensure your bathrooms are well stocked, to have hand sanitizer at key points around your facility, to clean frequently used indoor hard surfaces at least daily, and to clean frequently touched areas and surfaces several times a day. Maintain disinfectant solutions at appropriate strength and use in accordance with the manufacturer's instructions. Develop strategies to address cleaning of high-touch surfaces. Staff to wash hands thoroughly with soap and water before and after cleaning, and ensure contactless payment options. Now to record keeping. I would like to reiterate that Service New South Wales had developed an app which we just talked about, but there was no mandatory position in terms of you having to adopt this. It is another resource that may be useful to you. So you're encouraged to use it if you can or if you're willing to do so. You need to keep a record of a name and a contact number for all staff and customers for a period of at least 28 days. For group bookings, one contact is sufficient to support contact tracing. Where possible, personal details should be collected in a way that protects it from disclosure to other customers. And ensure records are used only for the purposes of tracing COVID-19 infections and are stored confidentially and securely. Of course, we understand that you always sell tickets, and you sell tickets for the purpose of selling them, and that is different to sort of contact tracing purposes. You should make staff aware of the COVID Safe app and the benefits of the app to support contact tracing, and you should consider registering your business through newsouthwales.gov.au, and you should cooperate with New South Wales Health if you're contacted in relation to a positive case of COVID-19 at your workplace. So those are the new guidelines. I will just post these in the chat box for Merrily and others to post to everybody. So you might get a copy of those right now. And now I'm just going to unshare my screen and go through your many questions which have just come up. So I'm just going to scroll down these and find them. Okay, so staff does include contractors and visiting workers or any worker on your premises. They are not to be included in your audience figures or your capacity figures. My understanding is it's seated capacity in terms of that capacity of your venue, but I will get clarification on that.
So I can just listen to it on that. I don't need to look at them. Thanks, mate. Keep refreshing. All right, thanks, mate.
Somebody has their microphone on. If you could turn that off, that would be great. Thanks. Yes, I would. Staff are performers in relation to this. So someone had a question about whether staff included performers. Yes, they do. Outdoor venues are not yet under this plan. So outdoor venues, I anticipate there will be guidelines that will be produced over the coming months in relation to outdoor venues, but they do not exist right now. There's a lot of questions about performers. Yes, they're considered staff. I don't have information on cabaret or table seating. However, my understanding is as long as it's ticketed and it's seated, it's something that you can do. But you may want to just incorporate that sort of physical distancing principle in between, so that you have a chair between people. But I will check in on cabaret type performances. I think if you were to undertake a performance in a place that isn't normally a theatre, you would need to undertake a seating arrangement that is ticketed, so that you know, for the purposes of contact tracing, that someone can find out where your booking was seated. School students, I understand, can be considered a household group or close contacts, because that's the way that they're considered at school. You may want to engage with the education department on that, but I can also seek clarification on that point. There's another question: 4 square metres or 50% capacity, whichever is greater. So confirming if for example, 4 square metre rule enables 100% capacity, but 50% enables 250 capacity. You can go with 250. Yes, this is correct. Sorry, that was 100 capacity, not 100%. But yes, you can go with the greater capacity. So one of the things that I've been very conscious of over the last couple of months that theatres have been able to open is that there have been many different interpretations around the square metre rule. There have been many venues that I've spoken to that have been reluctant to incorporate all publicly accessible space into their calculation for capacity, and so have been using their auditorium space as their entire calculation for capacity. So I think that 50% capacity will in fact give a lot more clarification to venues over what they can do in this regard. How does the capacity restriction affect the use of backstage for hirers? I will get clarity on this. There are a number of ways that I know that the sector have been responding to this in terms of sorry, somebody has their microphone on in the background and it's very distracting. If you could turn that off, that would be great. Thank you. I will have to take that question on notice in terms of hirers, but it's very clear that part of your premises is a workplace. So you should be looking at the WorkSafe regulations in relation to that. Okay. Okay, could we please discuss the 3-metre distance between performers and audience? This was vaguely defined regarding singing and rigorous dancing. It's actually 5 metres between singers and audience. This information is also available on our website at the moment, which we can point you towards, and it's also available on recent Health New South Wales website guidelines. The next question is, the only is the only recent change to this COVID safe plan the addition of clause 4 square metre per person or 50% of venue size up to 1,000 pax. Yes, it's pretty much the only change in relation to the last plan. So you already have a COVID safety plan in place for that 4 square metre rule. I would just suggest that you need to do an update to that. I will check back in with health, but that was the main change to these guidelines. There is someone is asking questions about instruments, brass and instruments, and orchestras as a whole. I'm not specifically talking about that material today, but there is recent advice on from New South Wales Health on brass and wind instruments. We are going to be doing a webinar about this next week, next Tuesday, with New South Wales Health. So I hope that we can answer some questions about that at that time. In relation to performers and people on stage, if they are part of a group that is undertaking professional work, then the guidance for them is around your sort of work safe plans and your risk management as an organisation, as well as the guidance that New South Wales Health are providing about wind instruments and singing. So there's two different things to think about there. It's quite complicated, and so we are doing a separate webinar on this next week. Is alcohol still only allowed to be consumed by seated patrons? Yes, that's my understanding. It's still the same. New South Wales Health have different advice on their COVID facts webpage singing in regard compared to what has been written on their recent upcoming changes. Do you know which is correct for venues? I will take that question on notice. I have some advice that is on our webpage at the moment around COVID-19 information, so you may have a look at that. There is different advice relating to group singing than group wind instrument playing. So I would suggest that you have a look at that, and I will get back to you on that advice. And as I say, we will do another webinar next week on Tuesday to cover off information relating to singing and playing woodwind instruments, because this is an issue that a lot of the sector are trying to understand, and we're going to try to inform you as best we can about that. Someone is asking about flexible spaces in terms of what if the venue isn't solely a performance venue. If something has a flexible seating capacity for that event, I would suggest that you implement a seating capacity that you can track, that you ticket, and that people sit in a designated seat. I will get advice from New South Wales Health about that, but the key bits of information that I understand is that your event needs to be ticketed and needs to be seated. So I would suggest that you, if you're doing an event in a space that isn't a theatre with designated seating all of the time, that you designate seating for that specific occasion. Capacity. Someone else has a question about capacity. That your four square limit for your 140 seat theatre is about 48. 50% is 70. It will be 70 that you can use now for your theatre. There is another question. If you can change the privacy policy to include New South Wales Health for COVID-19, will that be enough besides the New South Wales Health app? I'm suggesting that you're asking a question relating to the privacy policy around your ticket sales. As I said, The app that you have, that Service New South Wales were presenting earlier, is not mandatory. You can still use your regular ticket collecting ticket information collecting measures that you do to sell tickets as your primary contact. So that is sufficient. Okay, so 4 square metres in foyer with 50% capacity in auditorium, which one limits us? Whichever is the greater, whichever gives you the greater capacity is the one that you can go for. Another question, are performers and crew members of a theatre production considered part of the staff? Yes, they are. They do not get calculated in your venue capacity for audiences. It's a different thing. So your audiences are 50%, your staff are not included in that, your performers are not included in that. Yes, I would suggest that seating needs to be allocated. I would suggest the venue is responsible for collecting data for contact tracing, not your hirer. If you are the venue, then you will be responsible for collecting that data. Next question, are performers required to maintain 1.5 metres distance at all times? As your performers are workers, they are asked to retain 1.5 metres distance where possible. So obviously performing sometimes and quite often will require much closer contact than that. So this should be something that you look at through WorkSafe and through your own organisation's risk management plans for your workers. Are non-professional performers, community dance school performers considered to be staff? I think that there are a range of grey areas around this, especially when engaging with children. So we need to get some more clarity on those specific forms of performance for you. I don't have that information for you at the moment, but yes, it would be challenging, I think, to consider school-age performers who aren't being paid as workers. So we will need to get back to you on that. There's another question. I don't understand one seat between people and groups, as this is not 1.5 metres. I am going by the advice from health that says that you can put 1 to 2 chairs between groups for your bookings. And some people are looking at checkerboard seating. So next question. Someone is asking a question about the 4 metre square rule no longer necessary for theatres. I can offer you the information that I've already given you, which is about 4 square metres or 50% capacity. So yes, the 4 square metre regulations would have allowed you 90 in your theatre, and you can now have 180 in your theatre. That is correct. Another question, can I confirm if an individual buys 8 tickets, is 1 seat required between each non-household group in these couples? So yeah, 1 or 2 seats is what it says in the guidelines. So there are different ways that different venues are looking at how to do this kind of block booking. So I think it will be useful in the coming weeks for us to share the planning of, say, Sydney Opera House in relation to this, and other organisations as to how they're managing this booking. There's a few more questions about woodwind and singing. I'm going to answer that in a later webinar. I'm not specifically addressing that material today, but do feel free to contact me. My email is going to be at the end of this webinar, and I'm more than happy to answer your questions around that. For performances that aren't singing or high impact, there is no specific guidance around this. You may start your audience seating in front in the usual way, is my understanding. So yes, anything that isn't in this, people are asking questions about the old plan in terms of references to seating from the audience. So I would just suggest that you follow the information in this plan. Again, there's quite a few more questions around 5 metres or 3 metres. I will get back to you on this. I'll put it in the frequently asked questions part of our website. There's more questions about pubs. Unfortunately, I'm not dealing with pubs in this webinar. Please do feel free to contact me in the email at the end. There's questions about whether there's a difference between a group booking and a household booking. My understanding is that there isn't a difference. You can book with people that aren't in your household, is my understanding. And I will get some more advice in relation to community versus paid staff in terms of that back of house management. There's quite a few questions around community theatre, back of house and all that kind of stuff. Someone's asking me that the industry guidelines have disappeared. I would suggest that that's because they're being updated right at the moment, so they might just reappear on the website shortly. The next question is, can we clarify that checkerboard is not mandatory? Yes, from what it looks like on this plan, checkerboarding isn't mandatory, but staggering people. I would suggest that people can be seated directly in front of each other, which is something that I clarified from the last couple of months with New South Wales Health. So it's basically to the right and left of a seated person or a seated group. There needs to be seats, but front and behind, it's fine to book people into those rows. I would suggest there are different rules for restaurants. Somebody is asking that question at the moment. So I will try to get any information that I can find on singing, and anything that we can do around that. I'm going to try to gather so that we can do a webinar next week on it. Someone's saying that they don't have allocated seating but still ensure groups are 2 seats apart when entering the theatre. I would suggest that you email me after this. I would also suggest that you do try to incorporate a seating plan moving forward. This is all in relation to contact tracing, so that people can be found, and the people that's sitting next to them can also be found. There's the next question: does the audience need to be masked or encouraged to do so? It's not in the guidelines at the moment, but it's also something that some theatres are doing as part of their COVID safety plan. They are encouraging their audience to come to the venue and wear masks. It's certainly in the guidance around stadiums that people get to the venue and leave the venue wearing a mask. It's not currently in these guidelines, but I would suggest that if it's something that you want to do, that you are welcome to incorporate that into your COVID safety plan. People are asking me about the distances from the stage. I don't presently have advice around the distancing from the stage. I will get that advice back to you. My understanding of this advice is it's related to the capacities of your auditorium for people to enter. So it's limited to 1,000, and that really covers off quite a lot of venues and theatres in New South Wales at the moment. to have 1,000 people as that maximum. So it's inside your seated auditorium. It's 50% of that seated capacity, is my understanding. So how do you sign up for future notification of webinars? Merrily, I believe you have a Create New South Wales socials information somewhere on this slideshow that you could show the group. Oh, here we go. You can sign up to, here we go, isn't that beautiful? You can sign up to any of those socials and you'll get information relating to our next webinars. No, couples who purchased a ticket together can sit together. Groups that have purchased a ticket together who are close contacts, they can sit together. So that is the advice that I have. And the next question, if all patrons are booked into the system before entering the theatre, do we still need to have allocated seating? I'm not 100% understanding this question. I would suggest that moving to an increased capacity, it would be wise to allocate seating. I think it's, you know, it's part of your safety plan. It's probably not going to be mandated, but I would suggest for the purpose of contact tracing, it's a good idea because you know where people have been sitting, you know the groups that they've been sitting next to. So I guess it's a common sense application. I don't think it appears in the plans as such, but I'd suggest it's a reasonable way forward. I will get clarification on all of these questions and make sure they get updated on our website. If anybody also, that's all the questions that I've got through the chat box. Does anyone want to ask a question in person now? I feel like I've been talking to a small box of myself for the last half an hour. So if anyone wants to say anything or ask me a question in person, please do.
I'm not getting. Okay. Hi, Beck. I would love to ask a question. It's Anne-Marie from the Art House Wyong.
Hi.
Hi. One of the things I'm curious about is where the capacity sits at the 250, so like half your theatre and your capacity. How does that relate to your foyer then? Are you still trying to work with a 1 to 4, or you're accepting the full capacity could be in your foyer but doesn't meet the requirements of 1 to 4?
I'm working off the advice that I've been given, and I would suggest it is around the seated capacity of your theatre.
So it's acknowledging then your foyer would be breaching 1 to 4 then, because obviously those people have to get in and sit and in that side of it. Is that correct?
My understanding. So I'm working off the information that I've been given by New South Wales Health. So it's one or the other. So it's whatever achieves the 50% capacity for you. So my understanding with this is that the guidelines have been introduced in order to increase seated capacity of audiences in theatres.
So if your foyer doesn't hold your seated auditorium capacity, then you would have to go to the lower number. Is that correct then?
No, you go. Okay, so one of the things that I've been dealing with a lot over this time is organisations that have been interpreting that 4 metre square rule really differently, right? So New South Wales Health did a webinar with us and they explained that in your venue capacity calculations, you use all of your publicly accessible space, everything in total, to get the capacity for your venue. However, in various conversations that I've been having with different people in the sector, they've been very uneasy about including their foyer capacity or any other public space capacity in their venue calculations. And they were only using the internal calculations of their auditoria without stage to do their venue capacity calculations. So, I mean, in some cases, this has actually meant that that organisations were including a very reduced capacity limit inside their theatres. So, in some ways, this 50%, what I'm hoping is it gives more clarity. So you can have 50% of your seated capacity inside your venue, full stop.
And Beck, I completely understand. We were probably one of those venues. We have a very, very large theatre, and the irony is at 1 to 2, my capacity in the theatre exceeds what the capacity of the building is. So, you know, it is how you do interpret it, because we realised then that wasn't meeting social distancing. So thank you.
Yeah, no worries. So there are questions about the space in front of the audience that I will need to get clarification on. I'm sorry I don't have this information in front of me. I'm literally reading off the information that I've been able to get access to prior to this. Unfortunately, I wasn't able to get New South Wales Health to join this particular webinar, but I do want to get them into a later one. So if we grapple with the 50% audience thing for now, I'm going to get back to New South Wales Health with all of these questions relating to performers, audience, where you can sit, where you can start seating people. So I hope to get back to you hopefully within the day on that and get those things updated on the website. Now my email address is here. I'm very, very happy to talk to each and every one of you about your particular issues. As much as we can be of help and to clarify information relating to this, we hope to be. So please do contact me with any and all of your questions relating to getting reopened. So if anyone has any other questions, I'm more than happy to answer them now, or if you've got something a little bit more complicated to ask, please do get in touch. Yes, this webinar is being recorded, so it'll be up online. Thanks everyone. I know it's been such a challenging, difficult time for the entire sector. I do hope this is a little ray of hope in some very dark and challenging periods for us all. And wish you all the best with everything that you're doing. Please get in touch if you have any concerns. And hopefully we can get New South Wales Health into the next one. Okay. Thank you so much.